I'm Jerry Hesch from Hesch Institute in Aurora, Colorado. I practice orthopedic manual physical therapy, which means I treat joints. And this next year I have a book chapter coming out on my treatment of the upper cervical spine, specifically the first and second vertebrae, also known as the atlas and the axis. And my client Gary appears to be hyperextended at the atlantoaxial joint. And when I do traction to isolate the upper two joints, where the head connects to the first vertebrae and the first vertebrae connects to the second vertebrae, those joints are right under the ear. The cervical facet joints are in the back of the neck. So in order to do traction to those joints, my force must be in front of the ear and above. So I make my contact, the heel of my hand, on this part of his head. And I capture his head and I try and traction it towards me, and there's no movement with a reasonable amount of force. And what I should see in a normal client is I should see his feet move up and down. I should see movement that goes beyond the upper cervical into the lower cervical, down the spine, down into the legs with just about 15 pounds of force. There's no movement. So I put him in flexion now. And then I will attempt the same thing. It is solid as a rock. I cannot move it with a reasonable amount of force. And the same we found to be true when I bend it backwards. There's just no give. And that traction that's a normal movement. The atlantoaxial joint is the only joint in the spine that has up and down movement. There's like a peg on the C2 vertebrae, and there's a donut, which is the first vertebrae that sits on it, and it rides up and down on that thumb called the dens. And it's again the only area in the vertebrae all the way down that has up and downward movement, and that's what I'm evaluating in him. Okay. The other thing that we find is when I put my thumbs on the mastoid process, I can spring his mastoid and his occiput, and I can rotate it and I can side bend it. But when I put my finger against the transverse process of C1 or of the atlas, I can't glide it to the right. I cannot glide it to the left. If I come down to C2, boom, easy movement, very easy glide. Okay. If I bend his head just slightly and I come underneath the occiput, the big bump is C2, and if I come above C2, I'm on C1, spinous process or spinous tubercle, and I try and lift it up towards the ceiling and there's no give. Okay, I'm just below the occiput on C1, and now I'm on that big bump, that spinous process of C2, and boom, you can see how easy that moves. So we have restricted upper cervical motion. And the way that I'm going to treat it is I'm going to flex this table. So I flex his neck 10 to 15 degrees. And then I'm going to have him tuck his chin backwards. So tuck your chin gently backwards. Good, good, stay there. And I want you to just keep it tucked back. So it's not only tucking, but I also want you to glide it down towards the floor. Do you understand what I'm saying? Mm-hmm. Okay, good. So he's tucking his chin, and then he's gliding his head towards the floor, and do that very, very gently. And then I'm simply going to capture, again, this part of his head on both sides, and then I'm going to impart slight traction, and I can get slight movement there. So I'm going to test him for 30 seconds and make sure he tolerates the procedure well. And then I'll have him sit up and move around, see how he feels. And if he tolerates it well, which I expect him to, then we will proceed and do that for 2 minutes. And then test that and see how he does. And we might do it for a total of 5 minutes, we'll see. But it's a direction of treatment that's not common. You can look on YouTube. You can see all kinds of videos that treat the atlas for rotation, and you can see all kinds of mobilization and manipulations that come from the side. And there's little air hammers that put pressure on the side of the transverse process of the atlas and little percussion devices. But we're treating it in a forward direction, coupled with posterior glide to capture C2 to bring C2 back, and then to traction the back of C1 to drop the donut on the peg. And that's more mechanics than we need to cover here, but just for those who have an advanced interest in it. Again, that book chapter would be very informative, and I have several other YouTube videos on this topic. But I've showed you how I'm going to treat it. I'm going to treat it now. We'll stop filming, and we'll come back and we'll film the response.